Waiting for medical test results can be stressful, especially when there are not enough lab technicians to process samples quickly. Traditionally, diagnosing some of the diseases requires experts to manually examine microscope slides, a process some say it's time-consuming. A team at Makerere Artificial Intelligence Health Lab has developed technology using artificial intelligence and a microscope to help doctors diagnose diseases faster. Rose Nakasi, a computer scientist and lecturer at Makerere University, says the innovation will help detect diseases using AI and microscopes.
When you look at the microscope and how it is utilized, is that we need a skill set to be able to use the microscope, which is stood by the microscopists, all pathologists on the other end. But then we have very few of them. So once we are able to capture images through the smartphone being attached on the eyepiece of the microscope, then we're able to capture what we call digital images.
Using this innovation, a blood sample is prepared in the usual way, smeared and stained on a microscope slide. Instead of a lab technician manually examining the slide under a microscope, the Makerere AI team has created a 3D printed phone adapter that connects a smartphone to the microscope.
We have developed what we call a 3D printable adapter, which we print here at the lab using the 3D printers. And once we have this, the good thing about it is that it comes with adjustments so that any type of phone can be able to fit onto the eyepiece. So we make that in alignment with the eyepiece, and then we are able to now slot in and attach our smartphone. So we slot it in like that and then do make adjustments to have the preset arrangement of the smartphone in alignment with the eyepiece of the microscope.
The smartphone camera captures images of the sample, which are then analyzed using AI models trained to recognize disease-causing parasites and abnormal cells. The AI system identifies infections, reducing the workload for medical professionals and ensuring faster diagnosis.
You can see that the image is able to come on the screen of the smartphone, and what at the comfort of the technician, he'll just take the image without having to strain over the eyepiece of the microscope. And once that is done, so with our software already trained with examples of the parasites and whatever that we want to detect, we just run the model, which is already trained on the examples. It has stored knowledge about the parasites. For example, in this image, you can see that it is now able to identify and detect the parasites and the white blood cells. It even goes further to quantify them, which is actually a tedious process if it was done by a lab technician manually.
In a country where doctor-to-patient ratio remains low and diseases like malaria are still prevalent, this innovation, some say, could be a game changer.
We want to look at this application as a decision support that is actually going to support them in their daily routines, where they have been taking over like 1 hour to give a diagnosis. We believe that this is going to support them to quicken that process. It is both advantage actually to them, but also the patients. Because if we to go by the WHO standards, where they're not supposed to, analyze and diagnose more than 30 patients a day, we believe that with this modality, it comes in to quicken their work, but also the throughput or the number of patients that are going to be diagnosed in a day is going to increase. The amount of time that it is going to spend on analyzing a given image is going to substantially reduce.
When asked about the possibility of errors due to AI system glitches, the Makerere AI team had this to say.
It only picks information from what it has learned. Okay? Once it has learned a parasite, when you bring in an image that is having any kind of a parasite, it will be able to detect it. Once it does not see any of that, it will not make any detections on that image. Like any other computer program, once you give it the right data, it will provide you with the right results. So we try as much as possible before you give the data, the model training data, to be able to first of all check its quality, the quality of the data that you feed it with, and the outcome you expect at the end of that day.
As experts in science and technology advocate for artificial intelligence in healthcare, medics have expressed concerns that it limits fair medical imaging, claiming that it is not a reliable tool to depend on. Nobert Atukunda, NTV News.